Welcome back. We continue our discussion on complementary and alternative medicine. And this time we're going to be learning about homeopathy from our special guest, Dr. Yana Mostert. And of course, still with us is Dr. Nyati, who's a family physician. Dr. Mostert, welcome to Health Talk.
Thank you for having me.
All right. Now, just educate us a bit. We said that homeopathy and naturopathy, but we do know that the two are different. Please just explain the difference.
The difference is the homeopathic remedies that we use. They are unique to homeopathy. In homeopathy, we use specifically prepared high dilutions, but we would always also use the same kind of medicines that naturopaths would use. We would also use herbal remedies, vitamins, and other natural supplements. Naturopaths use the latter ones, but they don't normally use homeopathic remedies. That's the biggest difference.
Okay. So help us understand then the practice of homeopathy. Okay. Perhaps just in a few seconds, your training?
It's a full-time study for 5 years.
Right.
Most of that is theoretical, and then the last year contains quite a lot of practical experience in the clinics and homeopathic clinics that are on campus.
Right.
And you can study homeopathy at one of two institutions in South Africa. It's either Durban University of Technology or University of Johannesburg.
All right.
And actually in South Africa, it's one of the countries where homeopathy has the longest course and the most in-depth if you compare it to other homeopathic courses all over the world.
How many homeopaths do you have in South Africa?
I have absolutely no idea, but I would say a couple of hundred. Yeah.
Okay.
Yeah.
So what sort of conditions then do you deal with? And conditions, and as I said before, I mean, from the public point of view, people know diabetes, hypertension.
Yes.
And, so what sort of conditions do you then deal with?
All conditions can be treated with homeopathy, either as a modality by itself or in conjunction with conventional medicine. The two do merge quite well. I would say where we come into our own is where in acute viral conditions, we do quite well with coughs, colds, all the things where you can't use antibiotics and you can't use cortisol or cortisone to treat. But we do treat a lot of respiratory conditions like asthma. Allergies is another thing that we see a lot of. So eczema, asthma, respiratory conditions, digestive conditions like IBS, irritable bowel syndrome, we see a lot of that. The biggest part of our consultation is exactly the same as a GP's. So we would get the patient in, we would examine them, we would order blood tests if necessary. We would make a diagnosis, but then we do spend a lot of time talking to the patient to find out how their symptoms are different from their neighbor's symptoms. How is their cough different? And that is one of the things that homeopathy is based on. We would often prescribe the remedies on those symptoms that make your cough different from your neighbor's cough. So it's a very individualized treatment. And we would also employ the remedies to try and get your body to fix itself. We do not try to fix the problem for you. It's not, for example, an antibiotic that kills the bacteria for you. We try to stimulate your body's defense mechanisms to fix itself.
And how do you monitor your outcomes? Are there conditions that you say, no, this I can't treat, please go to hospital?
We would definitely refer if I feel that the vitality of somebody is too weak, if they just don't have their own defense mechanisms wouldn't be able to pull them through, I would definitely refer. And also if I feel that the problem has become too structural, that it actually needs surgical intervention, there needs to be other intervention, I would refer to a GP or for surgery.
Dr. Nyati, in your practice, I mean, have you had to deal with interreferrals between homeopathy and your general practice?
Yes, there's a couple of conditions that, I would say as orthodox doctors, we don't really do well in managing. For example, she mentioned irritable bowel syndrome. When you look at a patient with irritable, they'll come to you having tried so many other things, and we've got very limited arsenal of stuff we can give to them. And what I've found is that when they use some of the stuff from the homeopaths, I mean, I don't want to mention a particular drug here, but there's a combination of natural remedies. It's called Iberogast, which does very, very well to treat IBS, much better than the stuff that we have. And also for people with asthma, there's quite a number of people with asthma who don't want to be on long-term steroids. And when they use some of their products, you'll find that, the frequency of the attacks, is actually, reduced. So yes, there is room. I think we need to have more interaction because we know very little about the value of the interventions that they have. Yet, as the orthodox doctors, we don't always have solutions, to some of the problems that affect the patients that come to see us.
I suppose also the attitude that I know it all,
Yes.
and I can't refer to allied health, as it
Yes.
were. And your thoughts on how this interaction can be?
I'm really glad that I live in an age with antibiotics and with cortisone and things like that for us to fall back on.
Yeah.
I feel it's not always necessary in each case. I feel sometimes conventional medicine can be a little bit like a sledgehammer to treat a little problem. So I feel that's often where homeopathy fits in, at the beginning of illnesses when it hasn't gone so far, when you don't need the sledgehammer yet, homeopathy is great. But definitely, it's fantastic to mix the two, to mix conventional medicine with homeopathy.
So on that positive note that we're going to end this discussion for now. Well, thank you so much for your contribution, Dr.